Hi guys, so welcome back. It is your host, the bold and beautiful Wamaida Mashira. And thank you guys for keeping it at the Fireplace Studios. Every day posts, our liking our post, commenting. We really respect that choice, guys. And anyway, as you know the drill, just go to our YouTube channel and subscribe. Go to our Facebook page, like, follow, comment, repost, reshare, everything, guys. Today, I am in Siritamul Spa and Resort in Bungoma town, and it's so beautiful, by the way. You guys should visit. Welcome back, guys. My guests.
Thank you. My name is Emmanuel Agenda. I'm a clinician by profession. I work in Bungoma at a hospital called Western Family Hospital, and I appreciate to share with you this topic on today's issue, especially on female reproductive health.
So, Emmanuel, allow me to call you Emmanuel. Break down the fact or the topic, the female reproductive health, because many of my audience out there might just know RHS just by the name, but they really do not know what it entails or what it brings about. So break down the topic for us today, so that they can have a better understanding of what we're dealing with.
Okay, so basically SRH, or rather sexual reproductive health, and now we're talking about female. By definition, it should be a state of complete physical, mental, and social well-being of the of a person, regard to reproductive health, and barely minimum of disease or infirmity. So that is basically the definition of SRH.
SRH.
Yeah, and we understand that in reproductive health, most diseases, or rather conditions that affect reproductive health are on the side of women. Most of the diseases, or rather abnormalities, congenitals, usually affect women, and by prevalence, I can name a few. Most common to the lowest, I can start with endometriosis is one of the most common condition. We have the cyst. Among the cysts, there is ovarian cyst, which is most common, plus any other kind of cyst. We have also HIV/AIDS. We have sexual violence. We have uterine fibroids, among others, which are also rare to find in women. Yeah.
All right. Cancer is also a part of this.
Yeah, gynecological cancers
Cervical
are also
cancer,
parts of
ovarian cancer.
yeah.
Okay, so you have interacted, you're a clinician. Definitely, you have interacted with personnel or ladies with these issues on RHS.
Yeah.
And tell me, at what percentage do you think the knowledge about the sexual reproductive health has really been dealt with in the public side?
Currently, I can put it at 60%.
Okay.
Previously, there were very low uh, uh, people, or rather population, with the SRH knowledge, but with programs like yours currently, with also some NGOs, some government and CBOs, which are championing for good and healthy reproductive health for women, we find most people being able to understand about SRH services, where they can get the services. So I can put it at around 60. Yeah, sure.
Okay, that 60 is still a good number, because we are trying to develop the fact that we want to educate more women about their sexual reproductive health. You talked about the mental being of a woman as a factor considered under the reproductive health care. Do you mind explaining to someone about that?
Yeah, sure.
Okay.
Uh, Sexual health, or rather reproductive health, they go hand in hand, sexual and reproductive, because most often you'll find someone being low mentally, or having a mental breakdown, probably if they're having a condition like endometriosis, maybe a condition like infertility. Those
Okay.
are some things that can really put a woman not to be mentally okay, and now that is also part of unhealthy, yeah,
So
or rather
mentally,
disease.
um, let me just ask a very weird question. Do
Okay.
I need to be mentally okay to engage myself in any sexual activity?
Yes,
Mm-hmm.
because we understand nowadays we usually champion for the concept.
Consent.
When you are mentally okay, I'm so sure you can consent to sex, right? When you are not mentally okay, you'll have a wrong choice, or rather, not right
Consent.
choice.
So I have been doing this program for a while, and I have experienced women who say they wouldn't want to. They are married, okay, and they wouldn't want to really like have sex that oftenly, but they are having it because of the fact that they are married. And from my perspective, I feel like that is somehow rape because she's not giving you a consent to do it. You're only doing it to her because the fact that she's married to you. Am I in the same page or am I just misleading myself?
Okay. Once a person is married, we call it now. It's not just sex, but also congenital rights. Me as a husband, I don't anticipate to be denied sex. Okay, and you giving me sex because probably you are doing it because you are ought to do it. It's because of your mental issues.
Okay.
And now I understand that you need to consent to have sex, but now when we got married, you already consented for us to have sex. We don't push it towards now denying consent, but we term it like your mental problem.
Okay.
Now there are reasons or factors that are leading you not to be okay while having sex with your husband because of ABCD.
Yeah,
Yes.
you have basic reasons. So,
Yeah.
guys, my other question is, I wanted to understand how is it right now, according to our structure of the on the Ministry of Health and everything, how easy has it become for women to access the services on the reproductive health system, and how do they go about it now that you're in a hospital setup? How do they go about it? You know, a woman just comes in a hospital. She walks in and there are so many buildings, there are so many departments. She does not know where she is going. So I want you to help educate my audience so that they know how to access these services, where to go, when to go, how to go about it.
Okay. Uh, One, let me talk about the government. The government has made it so easy for women to access SRH services,
Okay.
and they are actually championing it to be more brought down to even private facilities, so that women can access SRH services easily. One of the most sensitive bit of health currently in Kenya, let me narrow down to Kenya, is reproductive health for women.
Yeah.
It's actually a most sensitive thing, and they don't want issues where people are being misdiagnosed, or rather during maternal death, during deliveries. Those are some things which government doesn't want currently
Okay.
to be going on. So it's as we're going on, where government is trying so hard for people to have access to these services easily. On your question on what time or when for someone should go and get the services,
Yeah.
we usually advise women to frequent and most frequent just visit gynecological clinics, or rather just general clinics where they can have
Again.
frequent checkups, so that the issues of misdiagnosis cannot come late, cannot come or be diagnosed later or late. Also, currently on a where we have a triage, we put a nurse at a triage. A nurse is usually a midwife, and they are actually trained on maternal health mostly. So they'll understand what service this one will need, so that they can direct them to specific services.
Okay.
So those issues of also delayed diagnosis currently are fading away.
Okay.
Yeah.
Which is a good thing. I think that is a plus to our government and also to our hospitals and doctors, because I think Zamani, we used to experience a lot of misdiagnosis, late diagnosis, and it was a really big factor that was affecting the female reproductive health. And okay, earlier you had mentioned on some of the diseases or infections, and I would really like you to just like label them out so that they understand what are like some of the visible signs, those signs that you just see and you know I need to go check up.
Okay. Some or rather most of these diseases of female reproductive health, you might find them hard to diagnose, or even women to know that they're suffering from them. You find a symptom which, when you stay with them, they don't actually affect you that big, but they do, especially when you're a teenage, because at that age you're only focusing on your adolescence life, where you want to try sex, or rather you're not there probably for procreation, reproduction. You're just there for yourself. You don't know if it's good or bad. Maybe you have not gotten about health education regarding reproductive health, and now you don't understand if having painful menstruation is a problem, or every woman understands experiences painful menstruation, because now you're just moving to your puberty stage. So some things like that, they usually make it harder for women to understand that they need to go and have a checkup for early diagnosis of conditions. Most also, some of those conditions come later in life, where women may think it's aging, or this is what other women experience, because now they have reached an age where they don't feel free to share about their sexual or reproductive health. Some also, they have conditions, for example, they're having infertility, then they turn down to themselves and having a mental problem, depression. So they can also, they don't want to talk about, they don't want to get married, they don't want to share anyone about the story. It makes them harder to be diagnosed. And maybe you'll find the cause of delayed, or rather the cause of infertility, is a disease which can actually be attended to easily. Yeah.
Okay, so we have stated every fact. And guys, we are going for a commercial break, and once we come back, it's going to get hot. You know me. Welcome back, guys. So we are in Bungoma at a place called Siri Tamu Resort and Spa. And just before I get back to our topic, I would love you guys to actually come check this place out. It is a very beautiful place. Just from the gate to the facilities, there are like international cuisines. There is a pool. It's kitchen. No, it's kids friendly. Wow, 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 hallelujah! It's kids friendly, and they have so many facilities. They have accommodation, they have nature trails, they have an outdoor gym, which I'm just gonna check it out after here, and I'm going to post for you guys muone. Najua hamjaiona gym iko nje, mmezoea ile ya ushago ya mawe. So just come here. At least if you're from Nairobi, you're in Bungoma or Kakamega, come here and wind. They have very nice food, very nice coffee, very nice cutleries, and at least come relax your mind off here and feel at home, sindio. And I am going back to my guest, Emmanuel, and he's looking very sharp today and very lovely.
Thank you.
Very lovely, but he's not single, my people. Not single. And I want you to explain to us. I would love you to tell us about the RHS rights.
Okay. Basically, they're called reproductive health rights, and there are as many as you can number, because everyone pulls or pulls towards themselves what fits them. But what are standardized by the government, or rather WHO, we usually advise people to know their rights. And one, their own choice to have reproductive health, that is either have children, access to family planning, choice to conceive or terminate a pregnancy, and also safe reproductive health,
So,
or rather
like,
safe sex.
now abortion is kind of like up to me.
Yes,
I can opt to just abort.
that is what our WHO guidelines put.
Uh-huh.
But in Kenyan constitution,
Uh-huh.
where we don't borrow everything from international bodies, in Kenya, our abortion or, bill that states abortion is only permitted by a certified, trained medical practitioner who has understand that your health is at risk, that is the mother's health is at risk. And now, by definition of health, we understood that we have physical well-being, we have mental well-being, socio-economic well-being of a person. So when you have either of these three things are not okay, that is, you're not healthy. And when you go down, talk to your doctor, well, he can permit an abortion. Yes.
Well, hey, I'm out here listening to abortion bills and I'm telling you people, they don't mean that ati mama yako ni mkali utoe. No. They don't mean your family is harsh on you, you utoe, or your boyfriend has refused the pregnancy utoe. Abortion is only permitted medically, okay? So let's level down to a condition called endometriosis. It has been a rampant condition that I have seen a lot of people undergo or actually diagnose it very late. And I want you to like educate my viewers on what endometriosis is, how it comes about, its symptoms, how it can be treated, or what to expect on it.
Uh, it's few years ago, around 10 or so, when we learned that endometriosis is a very common condition in women. Very common, actually, number one on the list on diseases of reproductive health in women.
Okay.
And maybe by definition, endometriosis is the growth of endometrium. Endometrium is the lining of the uterus, where the lining of the uterus which sheds during menstrual time or period. Growing now, those tissues of the endometrium, or rather the uterus, grow outside the uterus. They can grow on top of the uterus, not inside. They can grow around the ovaries. They can grow in your bladder or intestines. They can move to as far as the lungs or the brain, but on rare cases. Yes. Characterized by pain mostly, because now the same activity that happens in your endometrial lining, that is build up of a thickening of the lining of the uterus so that you can have your periods or rather shed them. The same process happens to those tissues that have grown outside the uterus, and now causing pain during menstruation.
So that pain just happens. As let's just take an example, like they have grown on the intestines, and during my menstrues, they will still shed.
Yeah, they will also shed.
Where do they go to?
The body absorbs them back. If it's in a place where the body can excrete, the body finds a way to excrete anything by itself.
So it's a mechanism of where the body will just learn
Yeah,
to excrete
or
it.
rather just absorb them back.
Wow, that's crazy. That's crazy. And like what apart from pain, because we cannot we can scale down menstrual pain. Everyone feels pain, or rather 90% of the women will feel
Most
pain.
women feel
So
pain.
can we scale down this pain, because I also feel pain. Now you're scaring me how
Yeah, I
maybe I'm
understand.
having it.
Uh, Most, okay, one of the pain, or rather that dysmenorrhea, that is pain during menstruation, just one of the most common symptoms of endometriosis. But now there are also other characteristic of someone will present with that one, pain. Two, dyspareunia, that is pain during sex. Three, hematochezia, that is blood in your stool. Four, hematuria, that is blood in your urine, plus now discomfort during your menses.
So like if we say pain during sex, pain in the uterus, cervix, the vagina, the
Right
womb,
from, it can be right from your vagina to your cervix to the
all the way.
uterus, mostly depending on where the tissues are. If the tissues are the tissues of the endometrium, which now cause the endometriosis, have grown probably outside, and now they have decided or settled to grow around your vagina, around your uterus, your cervix. During sex, you can feel the pain because now those tissues are pressing on close organs.
Okay. That's really that's like that's scary. I can't lie to you. That is so scary. And the fact that it's not outside that you can see and just like a
Yeah,
pimple and
sure.
poke it is really a factor that people should really consider being checked on, because we wouldn't want it to scale down to too much pain. But if you're out there, so the scale of, let's scale down pain from
Pain.
0 to what percent?
Okay, now we have people who have endometriosis, don't have symptoms, never have pain.
Okay.
We have people who have endometriosis, maybe small sizes, have more pain than people who have endometriosis, large sizes. So we cannot actually just ascertain it. We tell you that to a scale of 10, we have 7/10, or to a scale of 10, we have 1/10. It only depends with what the patient is presenting with.
So how do you get diagnosed on endometriosis?
Now, one, we get a good, clear history. Among the things that I've said, patient can present with those, that is dyspareunia, hematochezia, hematuria, among others. Now you can also ask the patient to give you a good detailed long history about the same. Physical examination, where you can get the nodules around the cervix of the vagina or the posterior fornix of the vagina. With your ultrasound, that will be vaginal ultrasound, you will also be able to see those kinds of endometrium look like
Cells.
tissues growing on those places.
Okay.
Your abdominal ultrasound will also show you if they have grown on top of the bladder, on top of the uterus, and now be able to diagnose. That doesn't mean you've already diagnosed endometriosis, even if you see those kinds of tissue-like cells of the endometrium. Now we have to do something called a laparotomy, or rather we open your abdomen, be able to take part of the tissue, go do a histology on it, then diagnose endometriosis. So we should definitely diagnose endometriosis after we've done laboratory findings on the tissue.
So we have to do a laparotomy, and then we have to do a laboratory finding on the tissue that is been extracted,
Yes,
and then now we diagnose.
diagnose
So
endometriosis.
after we now diagnose endometriosis on that tissue, and you've stood me up because I know what laparotomy is, do you have to open me up again?
For
Do you extract these tissues,
once
or
I've
you
extracted
treat?
the tissue across your abdomen, go diagnose. Then now treatment will come and depend on you as a person, desire to have children, because if, for example, most common sites of growth are usually on the uterus and the ovaries. If you have desire to have children and now you are diagnosed with endometriosis, uh, hysterectomy, or rather removal of the uterus, will not be a choice,
Yeah.
because now you want to be able to have children.
Children.
So if you're still on your tender age where you ought to have children, we'll opt to other kinds of treatment where we can do hormonal therapy, pain management as we push you to your time of conception. Then we can decide either to do a hysterectomy, or if the treatment could have worked, then we keep you on care.
The treatment. Okay. Wow. You guys, it was so intense, and I hope you've really understood that aspect on endometriosis, even if it's not really opened up. But I hope you've gotten the brighter aspect, like I have done, since I was also naive on this. But at least I have some clear picture on what this really is. And just to ask, like, if apart from infertility later on after endometriosis, what other things do, or what other diseases can erupt from endometriosis, or do we have any other thing?
Complications of endometriosis
Yes.
are few actually. Only rarely do those things turn to be the tissues turn to be cancerous, because actually they're just benign tissues. The one complication is now the one you said, infertility, because a lady will be removed either the uterus or rather the ovaries, if it could have grown to the ovaries to cause adhesiveness. But invasiveness, if it had gone to the brain, it can cause an infarct in the brain. If it had gone to the lungs, you'll have to go and have open chest surgery to be removed. But rarely will it go to those sites. If it could have gone to the intestines, it can cause intestinal obstruction, and I will also have to go and be done an laparotomy to excise those things in the intestines. So basically, those are the only complications that we have, because it's not something that will cause or grow to secondary tissues.
Okay, so let me ask, and like endometriosis might cause, are these people who are suffering from endometriosis stigmatized? Because I have learned that a lot of survivors from endometriosis actually lose weight. They actually become like very small and petite, and if they do face stigma or other, just the whole topic, RHS and everything, there's a lot of stigmatization, and women are trying to avoid the fact that they cannot even come to a hospital where there is a fellow woman to treat them, because I have heard of those stories where they prefer a male gynecologist, they prefer a male clinician, because they're facing, actually, if it's not even verbal, it is action-wise stigmatization. And if it is so, how are we trying to curb this in our hospital facilities?
Yeah, it's evident. The topic on endometriosis, it's usually a personal topic. You find most people break down when talking about endometriosis. The only maximum thing that can lead to this breakdown, or rather depression, on these women is the issue on infertility and the pain. Usually they have pain before menstruation, during menstruation,
And
after
after.
menstruation. So you find this person like a full 2 and something weeks,
They're in
she's just
extreme pain.
in pain. She can't do calls, duties, and work because of that. And maybe at work, someone will not understand that actually it's not by will, it's not voluntary. So those are the things that usually turn them to depression. Also, probably she got married without being diagnosed of the same. So coming to learn about it during marriage period, now unable to get a child because of such, it's usually a very depressing time.
Situation, yeah.
Yeah, but we usually advise people as early as your puberty, start visiting a gyne. Be very sensitive on small things, because they can actually be a start of a bigger thing. And also, we advise our parents, older women, colleagues, and also school teachers to teach our young girls about sexual, or rather reproductive health, because these are things which will grow our society with a positive mind, and avoid this late diagnosis to bring a healthy reproductive health
On women.
in women.
And I mean, by the term wanasema you teach your children, does not mean you just name the parts of a reproductive health. That is not education. I think you actually need to talk to them about it, explain to them what happens and any changes they might see, okay? So welcome back, guys, and thank you so much for interacting with our page, our Facebook page. Thank you for interacting with our Instagram page. Thank you for interacting with our personal pages. Definitely, I have gotten some very many congratulations, and it's all because of you guys, and I am so humbled. Just go to YouTube and follow our, or subscribe to our channel, like our videos at the Fireplace Show. Go to Facebook, like our page at the Fireplace Studios. Like my page, it's at on Facebook, I'm at Wamaida Mashira. on Instagram at _DAPH__KE, and keep it locked, guys. So as we conclude this conversation with the very nice and very calm, relaxed Dr. Emmanuel, I would love you to really share with us. Tell my audience just one thing they should always keep in mind about their health. One thing they should always remember.
Okay, thank you guys for keeping it locked. And one thing that I usually tell women is the first thing and first step to your healthy reproductive health is safe sex. Thank you.
You practice safe sex. I've been telling you, don't say you're not having sex. Have safe sex, okay? Like bang but safely, okay, my people? Bang, 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 but so safely. Safely means use a condom, honey. Use it, okay? Use it. Anyway, I am winding up this conversation from Bungoma. It feels so lovely. It's morning, so nenda kukunywa chai. I will share my reels on the stories on IG and everything. Keep it locked so that you can see Siritamu and everything. I will share everything about this place so that you can actually find a place to chill. I am out. It's the bold and beautiful Omaida Mashira.